Oh, hi, everybody. Thank you so much for joining us here today. My name is Natalia, and I am one of the practice administrators here at the Center for Developmental Psychiatry. And I'm actually going to be your host for our first ever Q&A session with Ask the Doc. So we decided to kind of go with this because we know this time of year brings a lot of changes. And we just wanted to create a space for our patients where, they could ask questions and hear directly from our doctors to get support on some topics that they might have some questions about. So I'm joined here today with Dr. Jason Dean and Dr. Divya Patel, two of our wonderful child and adolescent psychiatrists. And they've worked with hundreds of kids and teens, and they're really passionate about helping families feel more confident about anything that any challenges they're going through at this time. So before we jump into any questions, I'd like to give Dr. Dean and Dr. Patel a chance to briefly introduce themselves. So Dr. Dean, can you just introduce yourself to those who might not know you?
Sure. So I'm Dr. Jason Dean. I'm a child and adolescent psychiatrist and also an adult psychiatrist. Um, I work with children as young as 2, all ages of children, teenagers, and adults as well. My focus is really to take a kind of psychotherapeutic approach to even patients that I'm just seeing for medication. So if I'm seeing people for actually psychotherapy, then I'm doing psychotherapy. But I try to think of every case, even if it's just for medication, as that type of case where I'm trying to understand the whole picture. So that's kind of my approach to all the different things. Some of you may know me who are listening, but that's kind of the approach that I take, where we're trying to really place medication in the context of the whole person. That's kind of the idea.
Wonderful. And Dr. Patel, can you tell us about yourself as well?
Yeah, sure. So my name is Dr. Divya Patel. I'm a child psychiatrist as well as an adult psychiatrist. I share many of the same values that Jason mentioned, obviously, really trying to get a thorough understanding of the child's development. And a huge part of that is addressing it psychotherapeutically, even when we're treating them with medications. I also just have been trained to and like to work in like a family-centered way. And so a lot of my patients and families that I'm working with, I try to think of it as a whole system, and child is not living in a bubble. And so that's probably a lot more stylistic of me to work together as a family and as a system rather than as an individual when I'm working with kids. But yeah, I like to see all kinds of kids from all ages and have worked with a lot of different presentations. So I'm excited to talk to everyone today and see what kind of questions you guys have.
Okay, perfect. Well, thank you both so much. And I think a lot of parents are really going to relate to what you say. So before we get started, I do just want to let you guys know if you have any questions that maybe pop up during this webinar, please just go ahead and post them in the chat. We will go through all the questions that we can with today's time. But with that being said, we can go ahead and get started. So let's just go with our first question. So we have, what's the best way to make your kids listen to you? I have had to use a threat in order to make my boy listen to me. Example, I'm not taking you to soccer if you don't finish your lunch. It often works, but now I think it would be a little bit different when the kids are older. Any advice?
Maybe I'll jump in. This is one of the really central ideas, I think, in what we deal with, because so many of the kids that we see have power struggles with their parents. That's kind of what you're describing as a power struggle, where you can get them to do what you want through kind of coercion, or you can kind of like pull rank, so to speak, and but then you're alluding to this idea that when they get a little bit older, does that really work? Because once a kid is 15, 16, they can kind of do, for the most part, what they want, and you won't necessarily know. And then they're kind of out there floating, doing things, and you don't know whether they're going to be following, responsible um, things. I think that what it comes down to is really building trust and building a relationship. For example, if you think about, why would a child ever listen? Like, you're playing a video game, someone tells you to stop. Why would you ever listen? Why would you ever do that, right? And I think it's because you recognize that in the short term it's going to stink, but in the long term, you're going to get more things later. You're going to get what you need. You trust that. You respect the person who's asking you. and it feels good to do something that the other person wants you to do. And there's like this idea of reciprocity that you kind of expect that, okay, I'll give in this time, you'll give in another time, and ultimately that the child values that relationship and feels good that it's happening, which kind of motivates that. So I think a lot of times it's really taking a step back. So like in the moment, like what are you supposed to do? There may not be that much you can do in that moment to get them to do it, other than the way you're saying. But I would say it's really taking a step back and trying to understand like how to build trust and how to build that mutual respect and reciprocity. And then as the relationship is strengthened, then you have a lot more to kind of like to use.
Yeah, I agree, Jason, with what you said. I think that that's like sort of the foundation of a lot of the work that we do with a lot of families, right? Like building that trust and that relationship. I've also found like depends on the child and the family system, but sometimes behaviorally also kind of working to create a structure where the child feels like they have responsibility or ownership around certain things. And it's like just a little bit of a behavioral strategy to be able to build that trust of and it's just as simple as like creating a list of things that they have to do and rewards that they can earn, and it becomes a little bit more self-responsibility. You're not bribing them, but essentially you're not punishing them either. Like this is like a very clear cut thing that they can earn if they do what they're supposed to do. And sometimes when the kids are getting older, they have a lot more motivation and want to earn those things. And so, again, you're building some of that self responsibility and engagement with yourself with some of these behavioral strategies. It's family dependent, it doesn't always work for everyone, but sometimes just like, doing that in combination with a lot of the other work that we do helps create that trust and foundation.
I would also add, I mean, you're talking about like behavioral
Right.
plans.
Yeah.
So a lot of times, most of the time, the way that families get set up things up is kind of like you're automatically getting all these privileges, and then if you do something bad, right, you're talking about threatening to remove a privilege. I guess like soccer is a privilege. You don't die if you don't play soccer, right? But then you're in the position of always being the bad guy taking things away.
Right.
Whereas it's usually better to set things up. It sometimes requires like a total overhaul kind of how you're parenting. But if you set it up so like, the basic necessities, food and shelter, you don't withhold, but screen time, special things are privileges that you have to earn, and you have to earn them by being good. And you can even do it with a point system, or you can just do it kind of like implicitly, like, like you do your homework first and then you can play your video game, not you automatically get to play the video game. You didn't do your homework, I'm going to remove the video game. That way you're not always in the position of like a power struggle of being the bad guy, because it's kind of like, look, like you didn't earn it, right? So it's a privilege that you don't automatically get and you didn't earn it. So like, I don't know what to tell you, but then it's not as, they can still get upset, as they can get upset about anything, but I think that works better too.
Yeah, definitely.
Great, great. And then another question we have here is, how do you deal with the child who has a very high sense of entitlement and low self-esteem?
I'll take this one.
I'm processing that.
Yeah, I mean, it's difficult in some ways because it's a lot of these things, again, I feel are so in the context of what's going on in the family, how, the environment, what kind of um, upbringing and sort of stressors and things like that are going on for everyone. When I hear, low self-esteem, I do think a lot about like what kind of developmental hits this child may have had, like growing up, that may have um, worsened their self-esteem in some ways, and like understanding that better. But I do think like the overall answer around from me at least would be like understanding your child a little bit better, and helping them understand where this might be coming from, right? So there's many reasons why a child might have low self-esteem or struggle with feeling entitled or boundaries and all of those things. But the more that we can understand that, we can help parents understand that a lot better too. And it improves empathy and your ability to connect with your child, and like that creates a foundation for improvement, right? Because you do want your child to sort of hold those lines and be empathetic and not present themselves as entitled. And I think understanding why that might be happening could be helpful.
I see there's someone in the chat said, on this point, is medication a necessity or can psychotherapy be as effective? That is the perfect question for this practice.
Um,
Yeah, you can go ahead. You can go. I
yeah.
have something else I want to say. You can go ahead.
As a practice as a whole, I think it's for everyone that we really we love psychotherapy, and the reason is it helps and it works, and it's a pretty good long-term solution for children and for their development in general, and also for family systems. So I would say medication is not always a necessity. Sometimes it's used as a tool to help the child or family engage in psychotherapy better if there's other, vulnerabilities or challenges that can be reduced with medication so the child is able to participate in psychotherapy. I think that it can be helpful. However, in general, psychotherapeutic interventions for children have shown just as much or at least equal or the same level of improvement for most things. I think the only exception I would say is probably ADHD is one of those things where medication I would say is more of a necessity than psychotherapy. Do you want to add it?
I think it really gets to the core of the issue of what exactly we're doing, because there's symptoms and then there's like personality development. So symptoms are like anxiety, impulsivity, anger, irritability, things like that. And that is what medication does directly. So a medication can kind of control impulsivity, can kind of control anger, depression, anxiety, things like that. It does not, though, automatically change the underlying personality. So for someone who's entitled, for instance, I guess that means like you're supposed to understand that like you can't always get everything, right? Sometimes you have to put in hard work and you have to delay gratification, et cetera. And someone who's entitled, that's more of like a psychological personality-based thing. Medicine doesn't really directly address that. What it does is when the person is entitled and they don't get what they want and they want to throw a huge meltdown tantrum, the medicine could control that so it doesn't happen. But it's not going to make it so the person's not entitled. But over time, if the child in particular does really, really well and with good parenting, and when you add therapy, controlling the symptoms, like Divya was saying, allows them to engage better in therapy, and then you can learn all of that. But psychotherapy is really the thing that addresses personality development. And that's actually, I think, in our practice, what we're really trying to do is not just focus on symptoms. Because if you look in the diagnosis book, the DSM, it's all just symptom based, but no one's looking under the hood, really, so to speak, to see like what's really going on. And in my opinion, in our opinion, that's the bigger issue, because otherwise you have, an 8-year-old who eventually, when they're 18, it's like, surprise, like that's who they are now. This is their personality. And you can always change that too, but it's way harder to unwind and change someone who's fully formed than to steer them in the right direction initially. But I see someone wrote in the chat again. Okay. We have an 11-year-old, he's not on medication, and we're having problems with ADHD. Can psychotherapy still be as effective given that it may be late? So, Divya, you were kind of already starting to answer that, I think.
Yeah. Um, I have some follow-up questions, but I could say generally, depending, you're saying problems with ADHD, it depends on what the problems are. But exactly what Jason said, right? If there's symptoms of ADHD where your child's having difficulty concentrating, focusing, academically is struggling, those are all symptoms of ADHD, maybe impulsivity, hyperactivity, those kind of things. Yes, medication can help with that. And I don't think for an 11-year-old that would be too late. I think that medication can be pretty impactful at that age group. Psychotherapy, I do think at that age group is also pretty necessary because of the other things we talked about, developmentally, when you have vulnerabilities to ADHD, you have difficulties with boundaries and limit setting and impulsivity or behavioral problems. It causes a lot of negative interactions with either family, friends, and it can cause a lot of like internal personality kind of issues or low self-esteem. And so I think psychotherapy, working around like what that is, and helping the child to rebuild their self-esteem a little bit more, understanding ADHD a little bit more so that they're not viewing it as a vulnerability, but rather as something that, they have kind of tools and resources to work around. So I do think that a combination of both is usually what I would recommend for an 11-year-old going through some problems with ADHD. But medication definitely can be impactful for the core symptoms of ADHD in that age group, especially 11 years old, because that's kind of when school starts also getting a lot more challenging and teachers become a lot less, accommodating. And so it's not uncommon for around that age group where struggles that maybe were always there, but really sort of accommodated, are popping up a lot more as they advance on to higher grade levels.
Right. I would add they did a study, I think it was in the 90s, called the MTA study. And it was like a really large study on ADHD and stimulants. And they were looking to see how therapy affected ADHD. As Divya is saying, therapy, we love therapy. We do therapy all the time. Therapy helps basically everything except for the core symptoms of ADHD. It's very ironic because medicine works really, really well for ADHD, for the core symptoms of ADHD. But in this study, they had some kids were taking stimulants, like Ritalin, Adderall, those kinds of things. Some were doing just therapy, and then some were doing the combination. And the therapy they were doing, I think that it was like every day they did behavioral therapy, something like that. So like a very high level of therapy compared to what you would normally do. And it found that therapy didn't help at all. And that the combination and the medication helped a lot. And the combination of therapy and the medication was not any better than the medication alone, which is like the only example, like depression, anxiety, anger, everything else that we treat, behavioral issues, all of those things, therapy can be helpful. And when you combine it with medicine, it's better than either one by itself. And ADHD, the medicine works like really, really well. And therapy doesn't really do much. So, yeah.
Right. Yes. And I will add as a little bit of a, I guess, caveat is that once you are older, like when I have like teens who are like in high school, graduating high school, getting into college, and they've tried medicine and it's sort of like helping the core symptoms, but they're still having a little bit more executive dysfunction, than like focused ADHD coaching and like focused therapy around the ADHD coaching does sometimes help people kind of organize their lives better. But again, it requires a higher age group for the child to be able to engage. Usually they usually don't take anyone younger than like fifth grade. I think that's usually the cutoff. So that is something, I guess, but usually we always recommend it as an adjunct, like Jason said, to meds and therapy.
I wonder if it'd be helpful if we just talked about medication for ADHD and I don't know
Yeah.
if you would find that helpful. Oh,
Yeah, that is, one of the questions we have here. One is what should parents know about when deciding to start psychiatric medication like ADHD meds?
well, actually, someone posted a follow-up question in the chat. We have an 8-year-old. I'm going to read it out loud because I don't know if people watching the recording will be able to see it. We have an 8-year-old child who has been diagnosed with ADHD and is currently on medication. However, we haven't yet talked to him directly about the diagnosis. What would be the best way to communicate this to him?
That's a good question. And I think it comes up all the time. Usually I'm the one making the diagnosis, and then we're talking with the parents to figure out, how to communicate with the child. And again, I'm paying attention to the nature of the child, the family system, cultural kind of implications around some of these things also, to figure out what's the best way. But I would say like talking to their therapist or their doctor who you're working with, who's like making the diagnosis, to figure out like, what's the best way. I would say usually when I'm working with kids that age group, I try my best to explain it in as simplistic terms as possible, and using analogies that they can understand. And so, being very careful that it doesn't seem like a deficit or like a challenge, because a lot of the kids those age feel different than their peers. So although it's not necessarily equivalent, I like to always use my glasses analogy for kids that age because they kind of understand. Some of them have glasses, some of them have friends that have glasses. And what I usually describe is, I can take off my glasses and like get through my day and squint and like have a headache by the end of the day, or it takes me twice as long to finish my work. And I could probably still finish it. Maybe there's some errors. And I could probably get through, like that, but just maybe not as great as I would be if I saw 2020 with my glasses. And so, yeah, sometimes it's annoying to put my glasses on or find the right glasses. It looks different than other people, but it helps me, function in a way that feels good for me. And sometimes, like using that analogy of like, well, there is some utility in taking this. Sometimes they call it vitamin, depending on the kid, and like if they're already taking a different vitamin, I usually say like, hey, this is a vitamin for your brain, and it helps your brain function like to its sharpest capability. And that way you have 20/20 vision in your brain, and you can kind of, feel a lot better when you're at school and those things. So it depends on the kid, but I try my best to explain it in those ways. Sometimes it also helps to be in our office because they see, like, obviously I see other kids are coming. There's a lot of other people who are dealing with it also. So they don't feel as, targeted or like different than other kids. But that's generally what I usually do. I don't know, Jason, do you have any like other things that you do with your kids?
Um, well, I think the question is, I think the question is, how do you communicate this in a way that's not going to like hurt their self-esteem, which Divya, you're addressing too. And I often, it's funny, we like analogies. I often use the analogy of like, especially if a child's into sports, like a sports injury, like if you hurt your knee and you don't want to like take a break from sports, you just want to go out and play because you don't want to accept the fact that you have a limitation. You're going to go out and just like destroy your leg, you know. So either you accept that you do have, this is maybe a little bit different take. I think it depends, like everything, it depends on the child probably, but maybe with an older child, what I say is like there's either a difficulty there or there's not. And if there is, you either address it and it gets better, or you don't and you still have the same trouble, but it just doesn't get any better. Like not wearing the glasses. And so I think actually sometimes when we're too scared to talk about it, it actually accidentally stigmatizes it more. And so it's like, look, it's not a big deal. You have ADHD. Like a lot of people have ADHD. So you also have ADHD, and like we're gonna address it. You're gonna take a medication, and then you know what? You'll be fine. And then you'll be able to focus like everybody else, and it's not gonna be an issue. So just being very matter of fact. I do think it's important to tell the truth. I had a patient once where the parents didn't tell the child, and then he found out later and was very upset. So, that can happen too. Like I think also when I'm treating a child, I'm always thinking like, hopefully a child will get better and not need a psychiatrist anymore, but they might need a psychiatrist for a while. They might need a psychiatrist as an adult, and you always want them to have a positive association with coming to treatment. And so you don't want them to like find out later that you didn't tell them the truth, or like why'd you withhold this from me or whatever, and then it like just erodes the whole trust in the whole process. So those are some things that I think about.
Okay. And since we're talking about medication, is there anything that parents should know about when deciding to start any type of psychiatric meds?
I would say just on the topic of the ADHD meds, a lot of parents oftentimes ask me like if they're first starting a stimulant, they've heard like they might need to see a cardiologist and all of those things. I would say just like talk to your doctor. Usually we do like a pretty thorough overview of your family history and like family medical history and all of those things. And the only reason to get like further evaluation usually is if there's a family history or a personal history of like cardiac problems that are like structural related. So it's not like getting hypertension in old age or a heart attack in old age, but more like a hole in your heart when you were a kid or a valvular issue when you were a child, things like that. Then we will ask to see a pediatric cardiologist, make sure they do an echo and an EKG before starting stimulants. But typically we have that conversation with people like when we're first seeing them. But if that's like a question usually that comes up with the ADHD meds. With other medication, I think again, it's like very person dependent. Sometimes we might want to check lab work and things like that. But at least from our perspective, when you're talking to, a child psychiatrist or even a psychiatrist, like they'll be able to kind of ascertain what is necessary for the medications. I think the biggest, probably most like well-known obstacles is whether or not your child's going to be able to swallow the pills, and like talking to your doctor about like liquid formulations that might be available, and then also consistency, like whether or not it's going to be possible for them to take it the same exact time or same exact way every single day. But those are probably like the major things that come up with like starting a medication.
Someone wrote in the chat, is it possible to stop medication at a later time with sufficient progress through other forms of therapy? Yeah, so when we start medication for children, we're never thinking that it's going to be forever or even for a very long time. I usually think of it in terms of like a year or two. Anything less than that, it's like a little bit hard to really know what it's going to do. And that goes back to what I was saying earlier about the symptoms and the personality development. So if you took, as an example, let's say someone's a 50-year-old man takes an anxiety medicine and their anxiety goes away. And then 2 years goes by, and then they stop the medication, and then their anxiety comes back. So it's like kind of the same person. But if you do that with a 5-year-old, and during the years between 5 and 7, that child does therapy, right? And you're parenting, and the child just has really successful years, that child's developing. So if you stop the medication at 7, it's possible that the biological vulnerability will come back, but that child's totally different. When you look under the hood, so to speak, that personality development is totally different, and you've gained all of those developmental gains. And so our goal is, yes, to start a medication, to then, either we're doing the therapy or someone else is doing the therapy. We're working with you on parenting, and you're just trying to, I always say the best medicine is just like a successful childhood. If you could just get like a really solid year in, usually things are so much better. And we often find that when people come to us, they're like in a rut, or there's a vicious cycle, right? Like for instance, a child is having tantrums and hitting their parents. So the best parent in the world, like, how are you going to respond to that? It's not going to be like, oh, this is so fantastic, this is happening. It's going to be very negative usually. And then that leads to, more anger and more acting out. And so you get into this vicious cycle in a rut. You use a medication, you lift them out of the rut, and once they're out of the rut, a lot of times it's fine, and we do that all the time. So our goal is usually every year or two to consider stopping. We don't use medications that you get dependent on, meaning that you physically cannot stop taking them easily. I've never had an issue getting people off medication. So yeah, I really think of it as like a tool that we're using for a very specific purpose and time frame.
Yeah, I agree. I think as a practice, we're pretty conservative with medications in general. And so like using it as a tool when it's needed, and like being pretty assertive when it's needed, I think is definitely important. But I do agree, like always reassessing. I think the benefit of our sessions of like having therapy included is that we're always kind of reassessing the child's development, how they're, coping, and like how that's improving. We're always checking in with the parents around that too. So I agree. I think it is possible to stop medication if we feel like there's sufficient progress that's sustained. I think the biggest thing for me is whether or not it's sustained, and then it remains sustained after we discontinue the medication. And like having the safeguards of therapy obviously is helpful because you can continue to monitor the progress and make sure that a lot of those symptoms are not coming back.
Maybe I could say something about like when to consider medication, because that's a big question that comes up for a lot of people. So I would say I usually think of like 3 main domains. One is subjective distress. So for instance, if a child has anxiety or emotional dysregulation and they're having frequent tantrums, meltdowns, right? So in addition to that being problematic for their functioning and for the family, that doesn't feel good. So that's one thing. It can be warranted to use medication just for that. Even, some people, they're doing fine, like they're getting great grades, doing well socially, but they're just having like a lot of anxiety or panic or something like that. Then there's functioning. So that's like, functioning with your family, functioning at school, functioning socially. And then the third thing, which I think is the most important, is the developmental trajectory. And that's actually when we do our evaluations, we do a pretty thorough evaluation, including meeting with the child twice. And There's a lot of reasons why we do that. One of the reasons is because sometimes seeing two different time points is helpful. But also it's to get that deeper understanding of who this child is, because just diagnosing ADHD is one thing, but then to really understand how is the ADHD actually impacting their development, their social emotional development, which is the most important thing, because that's who this person is going to be as a person, right? So for instance, if the ADHD is affecting them socially. So we were talking about an 11-year-old, Divya, you said that school gets harder, but also socially, until maybe like 8 years old, 9 years old, people will let things go. Like kids will let things go. Once they're a little bit older, they start to become really mean. And there's a lot of social fallout that happens around that age. And so if we start seeing that, like, the inability to like control your impulses is affecting you socially, and that's going to lead down this really negative path socially, that's really, really important. And that's not something that the diagnosis itself will necessarily tell you, but that's something to really consider. So that's how I look at that.
Yeah.
Hey, there was a follow-up question here. What's the best way to talk to my child about the symptoms of ADHD?
Could you clarify, actually, I think it's Luna, right? Could you clarify what you mean exactly? The best way to talk about which aspects? I know you can't talk, but you could text it in the chat.
About the symptoms of ADHD. I mean, if I'm understanding correctly, I would start with the specific symptoms that your child might be having, so that you can like relate it personally, right? So if they are having difficulty with school or difficulty with friends, or find themselves, constantly getting negative feedback from their friends that you're pushing me or you're doing something that you're not supposed to do, maybe like starting there and acknowledging that that's not something that they feel they can help, and that, there's things out there that we can do to help them curb some of that what we call impulsivity, but you can just focus on like their behaviors or problems they may have brought up themselves, right? Like, I'm having a hard time focusing, or I'm getting distracted really easily in class, and sort of go from there. But I would say the best way is the questions they're asking, kind of relating it back to the symptoms that they are experiencing, or like how it's impacting their life personally.
Yeah. Oh, talk about the condition itself. I mean, I hope I'm understanding what you mean. I would just be very, so just like talking about anything that's difficult with a child. I mean, as an example, let's say someone passes away or parents getting divorced. This is just one more example of how do you talk to children about something that's complicated and something that could be negative. Um, I think it's important to be truthful, like I was saying before, that you tell the truth, that they do have something. I think it's important to consider the child's developmental level. So the way you would talk to a 6-year-old would be like wildly different than how you talk to like a 15-year-old, you know? Um, I would just be very matter of fact and not sometimes like we as parents and as adults, we allow our own anxiety to cause us to over elaborate. So you might tell your child, like, let me tell you all about the neurotransmitters involved in ADHD. And the child's like, I don't know what you're talking about. I don't care. It's like overwhelming to them. It just causes more anxiety. So I would just keep it really simple. And, I think I would just, especially ADHD, it's like, it's not their fault. Not anything is like your fault, but I'm saying like it's thought to be like a pretty purely neurological thing. You know what I mean? So it's like this is just the way your brain developed, just like someone needs glasses, some people have diabetes, you know what I'm saying? So everybody has something. This is the thing that you have, and we're going to address it. I think also children are always looking to their parents to say like is it safe? Like, is this okay? Like, am I going to be okay? Like, can you handle this? I would just really kind of exhibit like a calm, confident, even if you're not feeling that way when you're talking about it. I think children need to know that like things are going to be okay. So it's like, for instance, I think you have this thing. We're going to take you to this doctor. We've heard great things about this doctor, and this doctor is going to figure it out. And like then he or she is going to help us, and like we're gonna take care of this problem, right? That's a really good approach, I think.
Yeah, I agree. And they might have follow-up questions, and then you can kind of just like figure out how to answer those questions in a way that again is stabilizing, grounding, and comforting. Also, like reassuring that you're looking for a solution. So sometimes kids, feel reassured that they don't have to worry about this because your parents are already sort of figuring it out, and there's things in place to do it. I would say if you're continuing to have like need more clarity on how to do it, I would also say like talk to the person who is making the diagnosis also, because they might have more insight on your individual child and like yourself as well. Then they might be able to give you more specific like suggestions on like, hey, we could try it this way. They might offer to do it with you also if that feels more grounding for the kid. I hope that's helpful.
Okay, and how do you define success for kids with ADHD?
What a loaded question. um, I mean, I don't know. I would say it would be the same with someone without ADHD, right? Like, I think when we think of children and their success, we usually often like to think of like their ability to engage in the things that they want to engage in, that family wants them to engage in, the level of happiness and contentment in those things, and the level of distress, right? We don't want our kids to never feel distress, but we also want them to be able to navigate it in a way that is well controlled and feels contained in a lot of ways. So I would say like a child with ADHD or without ADHD, the principles would remain the same. Um, if we're thinking about the core symptoms, right, it depends on the struggles they might be having. But for example, academic success might look different for a child with ADHD, and then really figuring out where they started and where they are, and seeing if that seems reasonable and that seems like content for the family. But it is so dependent on the family and the child and where they're starting. So I feel like it's kind of a hard question to answer. But again, it's something to think about with your psychiatrist and your therapist, and like think about it with your kid as well, because I'm sure they're thinking about their own like dreams and successes as well as they grow older. So if you're forming a better foundation of trust and communication with your kid, then you guys can think about it together. What does that mean? But I'm sure we all have, even as adults, we think about like what success is and like what that means to us. So I feel like for a young child especially, I would try to keep the principles as stable as possible for all of your children, regardless of whether or not they have ADHD.
Right. I think speaking even more broadly, just about like a child who's neurodivergent in whatever way, um, I think it's tough, but the balance is you don't want to have like a nihilistic approach where it's like, okay, well, my child, can never be successful. On the other hand, you want to be realistic that, I mean, ADHD, depending on the situation, often or usually has really no negative effect if you treat it long term on success. I will mention, by the way, untreated ADHD actually does increase the chance for substance use, like drug addiction, incarceration, and divorce. So treating it is actually really important for that reason. But a lot of kids have ADHD, like inattentive type ADHD. They can't focus. They take a medication, they can focus. They'll have the exact same success as they would have had. Sometimes that's not the case though, so you want to be realistic, because if you're always trying to like measure a child's success by, a metric that's impossible for them, like truly impossible for them, then they're always going to feel less than, because we were talking about self-esteem before. Children develop their own self-esteem largely in how they feel like that parent-child relationship is. And like, I like saying that, you like children see themselves in the reflection in their parents' eyes. You know what I mean? So how the parent sees them is how they're going to learn to see themselves. So you want to balance that. That's a very hard balance to strike, because you want your child to be really successful. I would also say, and I think Divya, you were touching on this, there's different types of success, right? There's academic success. So maybe certain people, let's say if you have dyslexia or different things, maybe you're not going to be as academically successful as you could have been. But there's other forms of success also, personal success, if you want them to have good relationships, things like that, being, involved in the community. There's different ways. And I think that certain children, if they have ADHD or let's say a few learning disabilities, and like they're not going to be super, or you don't think they're going to be super, super successful, allowing them to get through school without it like scarring them, and without it causing such, such poor self-esteem, that then that's going to ruin all the other aspects of their life and success, so I think that's really important. Making sure that those children have other outlets, whether it's art or, making sure that they're doing well socially and things like that. Sports, maybe they can't read well, but they're incredible at sports, so encourage them to do sports.
Yeah.
Okay, we have a question here. How much screen time is okay for a child who primarily relies on screen time in his free time? He's not interested in playing with other kids or going outside.
That's a good question. I think like a question that a lot of parents in today's like sort of day and age are struggling with, especially kids with ADHD. We know that they sort of are like geared towards video games and screen time. And we know like as doctors and some parents might know as well, like it does have to do with some of that dopamine functioning in their frontal cortex, where looking at screens and playing video games does kind of help stimulate that part of the prefrontal cortex that other things maybe don't, as kids with ADHD. But I think it depends. I think that line is always trying to engage them socially when we're thinking about success, right? And we're thinking about like social development. Like we do want our children to be able to engage in other things outside of the screen. So how much screen time is okay? I would say what feels contained for your family, like the least amount of screen time that feels possible for your family, right? I think all families are different and there's a lot of different complications around why screen time might be needed. And so the goal should be to decrease it as much as you feel is possible, and adding something that they are interested in sometimes helps, right? So activities a lot of times are like a savior for a lot of our families, because that's something that's outside of the house. They have to go, like there's no distractions there, and that's like an hour away from screens automatically. I think also like engaging with yourself, if they don't want to play with other children, like are they able to do one-on-one things with yourself or with another adult in the house, or someone that they're familiar with, that again engages their brain in different ways in a safe way that isn't necessarily forcing them to be social with people they feel uncomfortable with. But that's a larger thing to kind of discuss and figure out as a family of like how you can do that. I do think it's important to engage them in all the aspects, like socially outside of screens, for sure.
Yeah, I would also add that a lot of children in the situation that you're talking about, they're kind of escape. They're using devices as an escape. Like a lot of the social interactions now are on like Discord, or like they're playing video. When I was a kid, you would go to someone's house, you could play video games with them, but you're actually in their house. Now it's just everything's just online. And I think that a lot of children, in particular, if they have a hard time with social skills or social anxiety, let's say, they kind of escape the real world for like their fantasy digital world. And video games nowadays, I think, are different than, they're often just like these unending games where they can feel an incredible sense of like competence, And so I think certain children who they struggle to really feel like good at anything, they feel like they're really good at video games, right? So it's like you have the dopamine hit, like you were saying, and then you also have the fact that they can feel good about themselves, they can feel competent, it's safe, it's comfortable, they don't have to like kind of push themselves. But that's really that's kind of dangerous in a lot of ways, because you do have to eventually function in the real world. In a broader sense, I worry about this generation of children, actually, how they're going to actually function one day when they have to actually interact. But yeah, I would definitely push, and I like this idea that Divya was saying, you have to give them activities that are not digital to replace the digital. And it goes back also to the idea we were talking about, like an incentive plan, that if the screen time is automatic, they have 6 hours on a Sunday, 8 hours on a Sunday. Now you're the bad guy taking it away. You should set the rules up initially that they only get a couple hours and they have to earn it with good behavior. If they're not doing all of these things, like, first you have to go out and play tennis and then you can use your device. If you didn't play tennis, you can't use your device, or you could do a ratio. I heard someone tell me this that I thought was helpful. You could do a ratio, like you have to do 2 hours of like real stuff before you spend 1 hour on a device, something like that. And that way they can earn the device time by doing the real things. It's like baked into the arrangement.
Yeah, I agree. I think like a set plan like that. And I think the important part is working with someone to make sure you're communicating it like clearly and upfront, because obviously it could lead to a lot more behavioral issues if you're just sort of deciding like, okay, we're going to try this. Like I think like talking about it as a family and having that meeting and letting them know that this is something that you're going to be trying, and this is the structure of the rewards. This is the structure of how they can earn screen time. It's not an automatic privilege in the house anymore. And if you want, you can explain your reasoning behind it, but also kind of validate that, yeah, like we understand why it's important. We're still going to give you a chance to be able to earn some of that screen time just in a more, maybe more limited way. And then like thinking of the screen time also like further, like what it is, if there's any way that you can contain some of like the video games compared to like educational YouTube time, things like that sometimes helps. If you're not able to really decrease the time, maybe like what they're consuming can be changed in a way that still helps their social development. And it takes some time. It's definitely a hard thing to do, and it takes time to like redo something, especially if they're already used to having a lot of screen time. But I do think it's worth that climb so that eventually they feel enabled to like engage in different ways and not just on their screens.
Great. And got one more because we're coming up to close to an hour. And then, if you guys do have any last minute questions, please feel free to drop them in here. But what should I do if my child is struggling socially or being left out at school?
So with a lot of these questions, it really depends, on the situation, but I'll try to give an answer, I guess, that would just cover many different situations. So it really depends why. So for instance, some children, their social skills are fine, but they have anxiety, let's say. So they're anxious about interacting with people that they don't know or things like that. So it kind of inhibits them. Other children really have, significant social skills deficits. Some children are on the autism spectrum, so that's obviously its own thing. But even aside from that, there are children who just they kind of lack social skills. So then it's a little different. It's not only that they're anxious, but that actually they're kind of like correctly assessing that it's not going to go well. So they're avoiding social things, or they don't avoid it, they do it, just doesn't go well. It leads to, issues. Other children are very rigid, right? And so everything has to be their way. So as long as they can play with their friends and everybody does everything that they want, they'll be fine. But otherwise, it always devolves into like a blow up, basically. And then, the play date has to end early, things like that. So with a lot of these things, it really starts with understanding why. Because those are all totally different. If a child is on the autism spectrum, that's a totally, totally different thing than a child who just is rigid and has anxiety. Certain things, medications can help, like anxiety, rigidity, ADHD often leads to social issues, like we were saying before, if they're impulsive or spacing out. But really getting a good evaluation, I would say, is really the most important thing with really most of these things. But like in this case, because understanding why will then inform what you do about it. And a lot of times if you skip that step and you don't really know why, you kind of go down the road for like a year or two, kind of going down the wrong path, and you don't even realize until it's been a year or two. And then you're like, oh wait, I've been doing the wrong thing. So it's really important just to figure out in the first place like what's actually going on. The last thing I'll say, because I feel like I'm talking for a long time, the last thing I'll say is you should really push your children. So if they're struggling socially and they want to avoid it, don't allow that, because that leads to just worse problems over time, that they'll just avoid things more and more and more. So you have to push them and really encourage them, but kind of figure out what's causing the issue.
Okay, it doesn't look like we have any additional questions popping up in here. We can end it on that note. So I guess I'll say thanks everybody for joining us for this Q&A. It's our first one. I feel like it went so well. And I'll send you guys this recording. So if there's anything that maybe you missed or you wanted to, listen again, I'll send that over via email. Please feel free to share this with any other parents who you think might benefit. And then, if you need any, we are accepting new patients, and it's a good time to schedule with school just being right around the corner. So we do parent sessions as well if you think that those would be helpful. And I think that's everything. If anybody, Jason or Divya, you want to add anything else?
Yeah, thank you guys for joining. This was definitely the first time we were doing it, but we're planning on trying to do this on a consistent basis to just give our parents a space where if you're having these questions and you just want to kind of touch things by us, or and like give parents a chance to sort of communicate their concerns, like I think it's a good space to have. So we're going to try our best to have this as like a regular space for you guys to join and ask questions. And yeah, it was really good to talk to everyone.
Yeah, thank you, everybody. I think I'll add just to go over who we see. So we see children as young as 2, all ages of children, of childhood. We see teenagers, and we also see adults. A lot of people don't know that we see adults, so we do see adults, again, of all ages. And so sometimes it's just worth considering also like parental mental health. Like these things are really stressful when we're struggling with our children, and it can affect parents' mental health as well, and that kind of reciprocally flows back to the children. So sometimes that's something to consider. But Natalia, what's the best way for people to reach out to the office if they wanted to speak to us?
Yeah, you can give us a call. Our number is 201-304-7552. You can also send an email to either me or to Courtney. I'm sure you guys are all familiar with her as well. C. Barron at Developmental Psychiatry. I am N. Kuat at Developmental Psychiatry. And those probably would be the best ways to get in touch with us. We also have text available at that number.
Yeah. Okay, perfect. Okay, thank you, everybody.
Cool.
Thank
Thanks,
you.
everyone. Take care.